That's Kwasi Kwarteng. Let's talk to Chris Thomas, Senior Research Fellow at the think tank, the Institute for Public Policy Research, the IPPR. Welcome. Thanks for joining us. So picking up on that point then from Kwasi Kwarteng about the changing state of the economy, have things changed enough for this extra increase to now be affordable out of general taxation?
I think it's very welcome to see that small step from 1% to 3%. It's clear that 3% is more appropriate than what was being offered earlier in the year. But actually, the circumstances have changed to the point that we should be pushing for far more. The government have been clear that their ambition is to level up the country and to build back better. And 3% seems incoherent with that. The cost of a poor pay rise will be felt in terms of retention, people leaving the NHS because they don't feel valued. And that's got consequences that are both economic and health consequences. So there's a question not only of can we afford this, but can we afford not to go further?
And what is the situation currently with retention and recruitment? How much of an issue is it?
So the really important context is that we came into the COVID pandemic off the back of a really severe workforce crisis. So after a decade of austerity that included really, really unambitious pay awards, so the public sector pay freeze, and then quite stringent kind of negotiations on pay, we had shortages in almost every single NHS profession. So that was the context going in. We've now had one of the most brutal 15 months that NHS workers will ever have experienced. Our polling of NHS workers earlier in the year showed that as many as 1 in 4 were turning to things like alcohol and drugs just to cope with the stress. It really is severe. And as many as 330,000 extra NHS staff are now considering their position in the sector. That would be the equivalent of 100,000 nurses, 8,000 midwives, staff we just can't lose. So there really is a problem both now, but a really severe crisis looming down the line if the government doesn't act.
And so you've said you still don't think 3% is enough. The Royal College of Nursing said it should be 12.5%. Where would you set it?
So I think the pay award as it's decided needs to be consistent with that Build Back Better rhetoric. So it needs to be enough to show recognition for the contribution NHS workers have made. And that means, I think, turning to what NHS workers themselves think and what the public think. Our polling has been very clear that 5% is probably the absolute minimum that would be a coherent policy. But there's a lot of support and almost actually universal support amongst the public for that to be even higher, around the 10% mark. Both of those would be affordable. What's sometimes missed from these conversations is how much of a public sector pay award comes back to the Chancellor. He recoups most of this in terms of income tax, VAT, national insurance contributions. So really he can afford to go higher. So we'd like to see 5% minimum, but there's scope to be even more ambitious.
You mentioned coherence, but there are others elsewhere in the public sector, teachers, for instance, who say they're facing a pay freeze. Where's the coherence in that? That's a slap in the face for them.
I agree. The key workers, that got us through the pandemic are now feeling really left out and unrecognised by the government's action. Last time we saw a public sector pay freeze, it led to big staffing shortages across the public sector. It didn't do what it was meant to do. It wasn't really good for government finances. We have a government that's saying they're going to level up, but freezing key worker pay, that's levelling down. And I don't think it's popular with the public. I don't think it's popular with the professions, and they should really reconsider.
So, I mean, obviously there's been the independent NHS pay review. Different sectors are looked at differently. In an ideal world, how would you see the system working to give more equality? I mean, do you think that there should be more equality across different sectors? Well, describe your ideal situation for pay.
So I think the ideal situation is the government looks genuinely at the merits of a pay rise. It feels like at the moment they're not seeing the merits of pay increases in terms of staff retention, in terms of what it means for consumer behaviour, in terms of people going out and spending their money. They're more concerned at the moment with this very kind of short-termism approach. So whilst I think it's right that we take things sector by sector and professions do have that negotiation between their representative bodies and the government, I think it comes down to the political decision makers to be a bit bolder and to say, actually, we think that in this circumstance, something like 5%, 10% would be appropriate for NHS workers.
Thank you very much indeed. That's Chris Thomas from the IPPR.